This is the ZMAR Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch ZMAR.
Many times we make things harder than it should be. Many times, even myself, I do things the hard way. We grind it out, and we find out later that there was a much easier way to do it. I've definitely done this with running and even scuba for that matter. I would do things the hard way and then find out that there's a easier way to do it, especially when you're getting more equipment, more technical. Obviously, they have classes for all of that too, and mentoring. And we'll get to employee benefits in a second, but they usually, even though advice is coming to the table, they usually fight and make it harder. But all this creates frustration, right? And even as silly as a kid's movie, and so in the movie Pixar Cars, there's Lightning McQueen, and I love referencing kids' movies because they always translate to real life in some capacity. So Lightning McQueen's trying to turn the wheel hard right to go on a dirt road, and it's just not working. He's falling all over the place. And eventually he learns that in order to go one way, you have to turn the opposite way. So in this case, you had to turn hard right to go left. And so many employers are trying to do the same thing. They're trying to race with these employee benefit programs, and they're cranking harder than they should. They're fighting premiums. They're fighting all this stuff, and they're trying to keep employees happy, and they're cranking the wheel just strong to the right, but instead they need to actually turn left to actually start going straight and making it easier again. Because the reality is businesses really need to start or in order to stay in business, they have to be profitable and maintain stability in some capacity just to survive, let alone even just try to get ahead. But at the same time, you cannot be naive about it either, right? So what I mean by that is sometimes they ignore the obvious. That's why I like Jack Welch from General Electric. He always says, what's the reality of this, right? Because we get so emotionally attached to certain things that when you're trying to make, especially business decisions or hard decisions, even in the home, that you're so emotionally attached to something, or you're naive because you're not willing to look outside, and maybe you're not aware that you're not doing it. What's the reality of it all, right? Just recently we had a business owner, because I had mentioned we could get predictable renewals, and then at least you could offset some of your new production or your new revenue goals with predictable renewals. His first response was, well, I can't just increase my prices to his customer because of healthcare. And I said, oh, so you don't increase your costs to your customers when your overhead increases, maybe taxes increase, your overall, shipping cost or product to build the widgets, that, you don't increase costs, you just eat it. And his response was, well, that's different. Well, okay, so how is it different than even just like even adding employee expenses or adding a couple employees so you could gain new business, and you have to eat that cost? Eventually you have to charge for those employees. Eventually you have to charge for those products. But it's still, they were claiming that it was just different. And I don't, it's just a mindset, right? Because they make things harder than it really needs to be. So really, how do you cut costs without changing the staff or your overhead or any other expenses? And you're just, it's like a snowplow where you just try to jam the snow in one spot and it doesn't go anywhere. At some point, it's already packed in. So I always say you have to review how you're processing or your process to evaluate renewals or benefit plans, and then look at what opportunities can be there to save money. Because you make it harder than it really needs to be because you play hardball with the carriers, and every year it's exhausting, right? And so even this week we had a couple pre-renewal meetings and a renewal meeting with large, mid-sized companies technically, but some will consider them large. They got hundreds of employees, and they're pushing back on the premium increases or what the carrier is doing. And the reality is that these carriers are going to eventually fight back with you and just give up and say, hey, we're not going to do this, right? They're going to play hardball just like you are at some point, right? And the problem is like some of these doctors out there, and I'm not throwing all the doctors under, but just the concept is there is where they give prescribed medications for symptoms of a problem without addressing the real root of the problem. And it's the same problem we have when we evaluate benefit plans. So when we're sitting across the table this week with these employers, it was like they were fighting a symptom to a problem before they could ever get to the root of the problem. And when you bring up the root of the problem, either they were confused and they had no idea what you were just talking about because nobody else has addressed it, or they gave feedback and say they have no idea what we're talking about, but they want to explore more, right? And so we need to address the process and how this is done, right? So one is just breaking it up. And I was talking about segmenting the benefits renewal so you have control of the levers internally. Let's get to the core issue. Where's the claims? There's a lot of health plans out there that are not providing claims data for given reasons, like maybe they don't have to, right? Fully insured platforms barely give anything. Even though they're supposed to give more now, it doesn't occur. You have to move to a different platform. And some people will argue, well, that means we lose our carrier. Yes, so let me ask you this. Would you prefer to shut your doors because of loyalty to an insurance company that really doesn't even care about you enough for loyalty to reduce your premiums and fully transparent on profit margins and administrative costs? Of course, they're not going to do that, right? So and then there are companies all over the countries that had to shut their door because they were too loyal. It's kind of like that story or cliche, if you want, if you will, but the dog lays down on the front porch and he starts howling. And so you can't figure out why he's howling, but you find out when he laid down on the porch, there was a nail on the porch and went inside, pierced his skin, but he didn't move to get away from the nail. It's the same thing. These employees are doing the same thing. Another analogy would be as the canker sore on your front of your lip, right? Somehow every time you touch it with your tongue, it hurts, right? But you still keep doing it. It's the same thing with this healthcare and how you plan for benefits. They just keep doing the same thing over and over again. And the canker sore keeps coming up every renewal, but we're not doing anything about it besides pushing back. It shouldn't be there. It's like sticking your tongue further into the hole and it hurts more, right? So, healthcare is the same way. You should definitely start the process a little bit earlier. Small and mid-sized companies need to start evaluating right now for January 1st. They need to get ahead of the spectrum. A couple things come with it. There's benefits to this, right? We have more time and freedom, for that matter, to figure out what other options are out there. Sure, they may not be the big branded purple colored logos, but they're A-rated companies, been around for a long time. They just don't put billboards on the highway. They don't need to, right? Because they have an independent channel to sell good quality business to employers to make sure it's done right. You could even get options outside of what you've traditionally been doing for years. You could at least explore it. You have more time, right? You could have a meeting here and a meeting there, but keep it tight so that way you don't lose track of any of your notes. And even weekly or every 2 weeks you have a meeting on this. It at least gives you more time to keep the ball moving in a positive manner. This gives the renewing carrier, more time to consider any changes. So we could actually, if we came back with evidence or came back with substance to counter the potential renewal, we have a little bit more leverage. And it doesn't mean they'll always move and they might come up with the excuse of, we're not ready yet. Well, that's fine, right? Let's get data together and make their job easier to say yes. We had one company where they had a 12% increase. And so when we looked at the claims report, because we moved to a carrier that provides a claims report, when we looked at them, the claims report, it was running healthy. We have no idea why I got the 12%. So we actually used the claims report they provided to us against them and said, hey, based on the loss ratio here, we're expecting some really good rate relief, right? It dropped, I think it was 6 or 7 points, almost in half, all right? And just by asking that. But we had data to provide to you. There's other companies, we don't have positive data to get back. They're not moving. We just had another renewal where the claims ratio was really bad, but we went back to them and asked them for relief, but we didn't have anything positive to provide to them. And they came back and said they weren't willing to do anything. And so it happens, but we need to have time to try to figure out different angles to attack it. Not to justify any premium increases, but there's tons of time that's wasted doing enrollments that are through paper apps. We met with a company this week that hundreds of employees and they still do paper applications. The HR people are going through these applications and checking every box, make sure all the information's in there, like birthdays and dependents and date of hires, simple stuff, social security numbers in some cases. There's a whole list of items that are way overlooked. and you're wasting a bunch of time back and forth. You have to track the employee down. Someone will go out of town because they're on vacation, or somebody's sick, or they're out of the office, whatever it might be, and you're sitting there wasting time trying to track this information down. It's just tons of things. So companies need to invest in more technology, more automation when it comes to this, because you're probably wasting more man hours in follow-up with paper enrollments than any negotiated decrease or rate relief on the renewal. And so you can win 2 times by getting a rate decrease in some capacity, whether it's rate relief or a new carrier that's willing to take on your risk. And then on top of that, reduce your man hours and wasted productive. So even though they're on salary, you're still wasting productive time that they can be focused on something else. Maybe they're not finishing projects, or they could finish more projects by freeing up this time, making it a lot easier. Your time on technology platform for enrollment, even if HR is manhandling the enrollments, will save them tons of time, because you can't advance fields without filling the information. It's just amazing that how much time is being wasted, especially when you get hundreds and thousands of employees that are still doing paper applications. Another thing that employers need to consider is retrain some of your employees on how to actually use the health insurance. There's an automatic assumption on what health insurance could be. It's like an open credit card. They slap it right onto the table to the provider's office and said, "Here you go, just charge whatever you want." And it's unreal that it's even developed and went down that path, but it's essentially what they're doing, putting down a company credit card and saying, "Here you go," and then a third-party administrator basically says, "Okay, you're responsible for this copay or your deductible," but then your employer is picking up the rest of the tab. That's essentially what it comes down to. So employers listening to this, why don't you just take out your wallet and give the company credit card to your employee and just tell them to go bill whatever they want? Because that's essentially what you're doing by leaving it open without any control or cost measure. So the employer that's coming in and says that, you know what, 8% is too much, right? And sure, it's always too much. It could be $1 is too much, but and the reality is it's just too much. Okay, well, how are we going to leverage this to reverse the trend? And you can't just keep pushing back every year. You have to make changes. You can't expect different results by doing the exact same thing. So having an open credit card without having to control costs is really going to amount to the same increase next year. We'll give you a couple examples of how we can retrain them, right? So ER visits is definitely the biggest constant overused facility versus going to an urgent care or primary care. So even my own example, this is a personal example. One day, years ago, I was having this chest pain, and it was lasting all day, and it was sharp pain. And it was definitely on the left side, and I wasn't sure. And I was like, okay, I need to do something about this, because this pain doesn't go away. It comes and goes. There was a whole day's worth, and it was definitely some sharp pain. So I decided to go to urgent care because I knew a little bit better. And then I show up and I said, hey, I don't know what you guys are planning on doing. They're like, well, we're going to hook you up and check out your heart. If there's anything wrong, we're going to arrange all the transportation and medical need to get you to the hospital. So it gave me confidence that if I need to go to the hospital, I'll have the care to go with it, right? It's not something I'm doing on my own or trying to drive down the road if there's still a heart issue. So if I remember right, that bill was somewhere around $650. It rings a bell, and everything came out normal. I didn't have to go anywhere. And if I went to the ER and complained about chest pains, they're probably going to keep me for observations overnight, which would amount to thousands of dollars. And I would have had to meet my deductible, which is at least $1,000. It's more because I have an HSA qualified plan. And so I would have spent thousands of dollars for the same bill. I went to urgent care and paid $650. And $650 gave me the assurance that nothing else is wrong. So now let's talk about $800 for 3 stitches. They weren't clients of mine, but in a conversation with a lady, she was super, super thankful that she was able to go to a teaching hospital in the ER, and for stitches, she hit her head or something. And she was thankful that it was a teaching hospital. Who knows what would have happened if they went to a regular hospital? But the reality is 3 stitches in the forehead can be done by usually any practicing physician or nurse that is trained for it. And you would heal just fine. And I'm sure there's exceptions to the rule, but I'm just saying this is a basic small injury that occurred and you needed attention to seal it up. They definitely, $800. So if I compare that to my story, so I have a personal story. I was on the ice with the kids. We were in a practice doing drills. A kid decided to chuck a puck last second as they were changing drills. It ricocheted off the pipe of the goal and hit me right above my eye. Thankfully, it was above the eye, not below. It definitely started gushing blood on the ice. It was interesting for the amount of blood just above the eyebrow. And then, so I'm trying to make a seal, but it's definitely open. Thankfully, a good friend parent was there and drove me to the urgent care and sat with me. And he didn't have to do that. And I'm still appreciative of that to this day. I ended up having to get 3 stitches as well, so comparable to the other example. And that bill was, I think it was less than $300. And so if not, it was right around $300. Well, and even if we call it that, that's a $500 savings per, or for that 3 stitches that I got versus going to the ER. So let's just say you have a company with 500 employees that are on the plan, right? So it might be, 6, 7, 800 employees, depending on the math and who's enrolled. And let's just say 10% of those people have an ER visit that needs 3 stitches. I'm making it up. It might even be less than that, but let's just say for my example, it's 50 people, similar issue with 3 stitches, at $500 savings per event. You're looking at $25,000 that isn't being charged to your claim fund. Now, some might say, well, it's only $25,000. We're a decent sized company with a lot of premium. That may be true, but that's just one thing, right? Times that by maybe other areas that you could be saving money, and times that by 3 other areas. For now, you're at 75,000, right? And so, I could keep going. There's so many things that you could cut cost on, right? That people are overlooking on a regular basis. And so we could train these employees to try to look at different avenues. I'm not saying they shouldn't go to the ER at all. That's not what I'm saying. I'm just saying that they may not even be aware of the differences and the amount of cost that's there. And you could build your health plan to provide incentives, and we'll touch base on that too. And just a snapshot of other areas that you could train your employees to at least think about other options. So like if you need a procedure or testing, you might want a second opinion. Second opinions have saved insurance companies thousands or tens of thousands of dollars, if not more, and cost that there might be other alternatives, a different point of view. Maybe we try something different before we do that. And sometimes those outcomes are better, right? You have to do the homework, right? We're speculating in a lot of ways. Like even when my kid had hip surgery, we're speculating like what's the best route to go, and of course we took a hunch with it. It's the same thing getting a second opinion. We did get two opinions on his hip, and so we have a general perspective of what was there, and we're able to make decisions instead of just listening to one and thinking that's the right answer and we're going to move forward, or the only answer. Another one is prescriptions, generic versus brand, even though some people will argue and say, I absolutely need the brand, or my doctor says I need it, or when I switched to generic, I had a reaction to it. Those are few and far between. They do occur, but a lot of people like maybe give them a financial incentive to actually buy the generic drug. That's really what it comes down to. They could reduce or eliminate their out-of-pocket expenses, once again, based on good behavior. Mail order versus retail counter is a big one. They may not even know they can do a mail order, or they know it's there, but they don't know how to approach it and get it going. And so provide them information on it. Telehealth is big, right? Ever since COVID, really. I mean, it's been around for a long time, but COVID really took off versus in person. But some bigger companies are going to direct primary care facilities. You could either build your own, which is even what Purdue did. Purdue University did. They built a clinic, and if you go there, it's no cost. Well, you could just contract. They're all over the place now, and they're growing, where the employer will pay a stipend based on the number of employees to a direct primary care facility or group, and the employees could go there for free. It doesn't cost them anything. And guess what? It doesn't make a claim against the claim fund, which means there's no expenses for those visits. And a lot of those facilities will give out free generics when you need it, right? So again, we're not putting expenses on the claim fund. And there's a lot more examples. Those are just some, right? The biggest thing is providing incentives for better outcomes. HSAs and HRA contributions are wonderful. We had a company that we recently renewed that they forced everybody to go with a higher deductible to get the premiums down, but they're putting money in the HSA account. Most employees aren't even going that far, but the employers essentially paying for the higher deductible, and employees are fine with it. It's worked out great for years. Definitely look into the direct primary care because you're eliminating the out-of-pocket expenses. So instead of having the fear of what's this doctor visit going to cost me, or if you have a copay, you just take it away. Like you're basically paying the provider for them on their behalf to go there, and so you're not expensing against the claim fund. How about eliminating your out-of-pocket expenses for your employees, right? For good behavior. In healthcare, typically higher rated facilities cost less. So you could actually, and the data's out there, so you're not having to do this research on your own. You could contract and go to facilities that if they go to those facilities, it's no cost. We have a contract in Chicagoland area, one of the biggest hospital systems. If the employees actually end up going to that hospital system, there's nothing out of pocket. Nothing. The employer's claim fund will pay 100% of it. The employees don't have to pay a dime. You just eliminate their financial worry. In some cases, on larger companies, you can put in programs if they go to like a circle of excellence. So like for transplants and other surgeries or even cancer, when their health is at stake, you could eliminate the out-of-pocket expenses for your employees. And in some cases, the employers are actually reimbursing travel expenses for them just to eliminate that need, and then still keeping them on payroll and just saying, hey, just go take care of your health and come back, right? So it depends on how they build the package, but you could create a financial incentive even on a smaller scale that if they go to certain facilities, you can eliminate their out-of-pocket expenses and their cost is lowered to the claims fund. And so it's just a win-win across the board. Again, higher rated facilities have reduced costs. It's just weird in this industry when it comes to providers, whereas automotive or any other industry, a lot of times you pay more, you get more value, but it's opposite in healthcare. Kind of ironic in a lot of ways too. You could also add medical advocacy programs so that way your employees are not navigating this healthcare system by themselves when they have a major claim or any claim for that matter. And so like we had one employee from a company had an issue with a birth of a child. I don't know specifics, but they were transported from the delivering hospital to another pediatric hospital, and they were there for weeks, as far as I know. All these bills are piling up. They didn't have an advocacy program there, but we end up having the employee hire somebody that we had connections with to review the bills and to save them thousands, right? And so, but the advocacy program, if you put it in place to begin with, it could give them more of the guidance and review those things, and they didn't have to pay it like this one employee did. It's already included from an employee benefit. So an employee benefits plan can be done right by investing into the people and products to make it work easier for your company. You work too hard to combat a renewal, you got to make it easier. You got to have levers to be able to pull and control these costs. You have to have flexibility so that you can maneuver things a little bit more because like in a lot of fully insured plans, it's all or nothing. You can't make changes. It's cookie cutter right to the deductible and co-pays and everything designed by them. You can't do anything. You got to give your employees some incentives and the right path to better outcomes and reduce healthcare costs. And obviously we talked about embracing technology. I'm telling you, you're wasting man hours by just continuing to do paper. Even if your employees are not tech savvy, your HR people will love technology and save their time and energy and frustrations that go along with it. And you're going to have a better opportunities for renewals. You can't wait and just keep pushing back on the carrier. It's exhausting. So you don't want to go through that every year. I'd say fix it, start now, get early of the spectrum, and so that way you have more time to put it together right.